Hi, it's Dave from the Teletriage Service. I'm calling regarding your patient you referred into our service today. What seems to be the problem? Can you tell me how the patient is?
My involvement dates back to the beginning when we started planning the Teletriage service, when we found out that we had the funding for it. We were in a very unique position to set up a service which is very special and local to the Wirral, unlike the other options, for example Airedale. What we've done is we've looked at identifying nurses who would cover the Teletriage service, provide a lot of training and education, and we recognize from all the work that has gone on before, that education and training is vital for this service to work. When Emma and the nurses started, obviously they were not used to community work, and we provided guidance to take a very different approach to the management of such patients, not textbook medicine, not hospital medicine, but a community pragmatic approach as recommended by NHS England for frail older patients.
The aim of Teletriage is to provide care in the care home, because it's believed that the residents get a better care experience by being looked after by an environment that's familiar to them with people that they know. So we will utilise community services that we have available to us to promote care in the care home wherever possible in an effort to achieve admission avoidance, because it's believed that looking after them in this environment provides a better care experience and more satisfaction for the residents. So the Teletriage service have been able to prevent unnecessary hospital admissions for a range of circumstances, but one that springs to mind that I felt was really successful was a resident who had a nephrostomy in the community, and when they were referred into our services they'd been into hospital more than 5 times within a month simply for their nephrostomy to be flushed, because they didn't have a care package that supported that flushing happening in the care home. So our staff liaised with the bladder and bowel team, who were really responsive and went out and assessed the resident, and then liaised with the district nursing team to provide a solution for that. That resident now is able to have their nephrostomy flushed in the care home and hasn't been into hospital for that situation since.
We know how important the partnership is between ourselves and the Teletriage team. When we've identified patients, I will let the Teletriage service know about the patient, as well as the end-of-life nurses, and either myself or the Teletriage nurses or the end-of-life nurses will go out to the care home to educate and train them, to support them.
The unique partnership that we have is that I have direct access to both the end-of-life care practitioner and the consultant geriatrician team. And if I have concerns about a resident that I think that somebody may be frail or has sort of a pattern of decline, I can liaise with both these services.
I support the Teletriage service with their end-of-life care training, as we share the same common goal to reduce unnecessary hospital admissions end of life, and part of that is support and training and education for the care homes.
I think for me, Teletriage has been massively innovative in terms of prevention of admissions to hospital. The service for us has been changing in terms of what we've achieved together. We've, as a staff team, grown in confidence in our ability to deal with complex situations that we would normally have been on the edge of in terms of decision making. We now feel that we can really be more involved in all of our resident care and link into that to make sure that that continues, whether they do end up staying here or the resident ends up going into hospital. Teletriage will keep us updated with what's going on, and that for me is probably the biggest thing that's come out of it, is that link into following the patient's care throughout the journey.
So I sent a lady up to A&E, it must have been a few months ago now, and it was unavoidable. We had to send her into A&E, and I spoke to Emma, Teletriage nurse, through the Skype and things, and the follow-up service, it was just incredible, because I went to the hospital later that morning to carry out an assessment on another resident, and I banged into her in the lift, and I said, "Well, wait," and she was just off to A&E. to check on our residents. I thought that was we've never had that kind of service before.
It's something that's never been there. It's obviously difficult for hospitals to provide us with feedback because of data protection and confidentiality. But there does need to be that link, and at the minute, Teletriage is it for us. That it's the way into other services that we need feedback. We're the ones that are going to be wanted to take that patient back. And sometimes you don't get the information, or you never used to, but we can get it now.
We can now, yeah.
And they've certainly
Through
Teletriage, yeah.